So, Joe, as you know, and all of our listeners know, of course, I've been a huge advocate for student recruitment. And it's very interesting because when we talk about student recruitment, something that we have to kind of leave out of the mix is compensation data, because we really don't have a lot of compensation data for podiatric medicine. And we definitely need that.
Yeah, absolutely. It's interesting. We've interviewed a couple people, and separately, I've gotten some communications either through texts or emails, and we don't have solid representative data from a national kind of level. So it's definitely something that I think is hard, because when students ask, we don't have a good representation. There's a massive scale in what you can earn as a podiatric surgeon and physician.
Right. And it's not just students we're recruiting, but how about the residents that are negotiating a new position, or if you're a practice and you're trying to bring in a new practitioner. And then APMA, of course, they're doing efforts on advocacy efforts. So it's always good to have that kind of information.
Yeah, and speaking of APMA, actually today I filled out a survey. So one of the initiatives that they are starting is to try to maybe bridge this gap and get some actual data from providers in terms of what their salary and their compensation looks like. And so there's a survey that's going out, and hopefully people will fill that out transparently and honestly. It's anonymous, so that's nice that, again, you don't have to feel awkward about your pay if that is something that you're carrying with you. But hopefully we can get some answers to tackle this problem head on.
Well, I think that the survey, and it's put out by a company called Marit Health, M-A-R-I-T. And my understanding is it's only been out there for about a week, and they have over 400 respondents already.
Fabulous. Yeah. And you can go to www.apma.org/compensation to participate. I'm sure if you just did a Google search, APMA survey salary, you could probably find it, and share your information. Again, we just were talking about this at our local APMA state meeting. In terms of negotiating contracts, it only takes a couple minutes to answer these questions and get aggregate data if we can get everyone to participate.
Yeah, it's interesting because once you're on the website, you have access to all the other information about what the averages are. And I think in December, they're going to put out kind of the final results. So it's exciting. And like you said, it only takes a couple minutes.
And there's an incentive. We all love incentives, right? So certainly if you fill out the survey, you are entered into a chance to win. I think there's $100 gift cards and a grand prize of $500 gift card. So, 5 minutes of your time, it's a pretty good ROI if you're looking for a quick little boost for some Amazon spending money.
Yep, there you go. And you know what? It's going to be in our show notes, so people can just click on that too.
Perfect. So be sure to visit www.apma.org/compensation and take the survey today.
Thanks, everyone. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the co-host for the Dean's Chat podcast. I'm joined again by my co-host, Dr. Joe Richey. Joe, how you doing?
Oh, man, Jeff, today's an awesome day. It rained, and anytime it rains in the desert, there's something just magical and wonderful because it's rare. But after a couple of days, I'll be over it and ready for it to be dry and sunny again. But it's already dry and sunny this afternoon, so.
There you go. Life is good. Joe, we have a phenomenal guest today, representing the American Podiatric Medical Association, Dr. Sam Dupre. Dr. Dupre, welcome to Dean's Chat.
Thank you. It's great to be here. I'm excited.
Oh, we're excited to have you. You are the Director of Strategic Analytics within the APMA, which is a new position and a new role. So we're going to dive into that. But before we do that, two things. One is we're really informal on Dean's Chat. So if it's okay with you, let's go first names. We'll go Sam, Joe, and Jeff. Is that all right?
Yep, I prefer that.
All right. Well, let me give you a little more formal introduction. Sam's education, got his bachelor's degree in animal science at the University of Vermont. He got his master's degree in applied ecology and conservation biology from Frostburg State University. And he got his Ph.D. in geography and environmental systems at the University of Maryland, Baltimore County. Sam is a senior statistician and data scientist with over 15 years of experience applying causal inference and experimental design to real-world challenges. When I read that, I had to practice that a couple of times, Sam. What can you define causal inference for us?
Yeah, absolutely. So we've heard that phrase, causation is not or correlation is not causation. Yeah. So this is sort of saying, what if it is, more or less? It's sets of techniques where, in circumstances where you can't set up a fully randomized controlled trial, something like you want to see how effective a policy measure is at helping prevent deforestation, you can apply these methods to make those causal links.
Oh, that's incredible. Well, we are so excited to have you as part of our profession. Nothing speaks like good data, right? So it's just, this is going to be a fabulous discussion. Joe, what are your thoughts?
So, I mean, that was an incredible background too, Sam. And we find sometimes the most interesting people have the most interesting stories. First, I'd love to hear how you got into APMA, podiatry world. And I think having that exactly what you described there are so many applications in the world of medicine and podiatry. So I'd love to get your take on how you approach big topics and something like this physician's compensation survey that's been launched. But we'll start with, how did you get into podiatry?
Well, it's a bit of a mix. So, my brother's an osteopath. I've been doing various sorts of public health related statistical consulting work for 5+ years now in those particular fields. My career trajectory has been an arc. Started as a big old hippie wanting to do conservation work in Africa, worked to found a nonprofit that's we employ over 500 folks at this point. I'm drawn out of it, but yeah, that went from that side into looking at, hey, people are important. And that led me to my research doing sort of modeling livelihood collapse among Guatemalan smallholder farmers into super uplifting work. And that led me into working at the Census Bureau, mostly supporting African and some Latin American countries, working to do their censuses and their surveys. After that point, I moved to a different group in census where I was the lead demographer for PEPFAR, the massive HIV/AIDS support U.S. government organization, and did a lot of work there. And when I moved from there to USAID, I was modeling foreign malign influence, so sort of the ways that China, Russia, countries like that try and influence other countries. But then USAID was shut down, so APMA was hiring, and it seemed like a great opportunity to continue my public health and medical-oriented journey. It's been an
That
arc.
is so interesting. Yeah, and just so you know, like I started as an art major, I was not medical. So I find it always so interesting, what we think we want to do versus where our paths take us. But there's so much opportunity for overlap and cross integration of concepts. And sometimes coming in with a very different perspective is incredibly powerful. So I would love to get that kind of second part of the question of there's probably more than just this physician survey that's gone out recently, but as it's the thing in my mind that I really want to pick your brain the most about, how do you approach things like this question mark of physician compensation when it pertains to things like our podiatry community?
Right. So in those circumstances, my newness, my freshness to the subject is an advantage. I come in, I don't have the burden of having been associated with some aspect of the question for however many years while it's been being hammered out. I come in, these big issues exist, and I get to come in fresh. And at that point, my general approach is saying, maybe my employer is wrong. Maybe our stance is incorrect. Maybe there are pieces that we can learn from the other side, quote unquote. And so the biggest questions are, so coming in ready to listen, like accepting I'm not the expert. These are deeply educated, deeply passionate people who have been hammering at these seemingly intractable questions and try and figure out, okay, what's everybody's stance? Where are they right? Where are they wrong? Right, wrong. And then based on those initial ideas, start exploring it. What data is there? How much do we trust it? and which of the narratives from both sides does data actually support. And as you noted, this is a new position for APMA, and this has been, it's a strategic move by APMA. The organization recognizes that much of the policy and the data on which it's worked has been anecdotal and ad hoc, and that's not just for APMA, that's a normal thing. This is a big trend over the last 5 to 20 years across many industries, and people have probably heard the term evidence-based practice, evidence-based what have you. APMA, under Megan's guidance and Brooke's guidance, are looking to move from using anecdotal data and things that don't really get at the underpinnings of these intractable questions to actually ask the question, what does the data say?
Yeah. Oh, I love that. I can't wait to dive in, Jeff.
Let's go. Which topic you want to start on, Joe? Want to start on the survey for salaries for podiatrists? That's a great place, I think.
Love to start there, because again, that's really what I want to pick your brain on.
Love it.
Do you want me to go, Jeff?
Well, I don't mind starting.
Okay,
so,
because I don't want to hog the interview, because
No,
I
that's
will
all
ask
right.
him every single question.
That's all right. So you with your job, this seems to be, correct me if I'm wrong, but it's like a big major effort, and one of your first perhaps on the job. How did you approach it? How did you design the survey? Do you start with the end in mind? I mean, I think it's really an interesting topic that we can dive deep into, but I would love your perception of the entire project. Is that a good? That's probably a good place to start. Okay.
Yeah, definitely. And quick rabbit hole beforehand, really segue. When I came in there, I had two foundational pieces that I wanted to hammer out. If you're trying to study a population, the workforce, our podiatrists, both members and non-members, you need to know how many there are. That's the very first thing. Because, for example, if you're going to do a survey, you have no idea if you've actually captured everybody, if you have no idea how many everybody there are. And so my two biggest priorities were figuring out a modeled approach to looking at who are the podiatrists, where are they, how many are there? And along with that, what is their workforce situation? And there's a lot that goes into that. There are so many different complicated pieces in trying to piece out the lived experience of any professional, any person, that it is a huge complicated question. And we were lucky in that Marit didn't design that survey for us. They offered to, they were willing to do some extra questions and things if we wanted to. But my priority was getting that information as quickly as possible. And their survey they have, they've rolled it out across many medical specialties. I think they have something like several tens of thousands of responses, 16,000. I'm not gonna guess, but it's in the 5 figures of numbers of responses. So there's a good comparable data set that we can use to sort of to look at questions like, how is satisfaction? How does that compare to other specialties? How does variation look for that? So one of the things that we've seen on the early data is that for compensation writ large for podiatrists, the amount of variance in overall compensation is way higher than many of the other specialties that Merit has looked at. So the difference between the lowest and the highest earning podiatrists seems to be much wider gap than many other specialties. And we had, thankfully, Merit's expertise to leverage in that they already had a survey. It was good. I looked at it, went deep into what their data elements were, and it's very well designed. They know what they were doing. And so we were able to work together to get it out quickly. And so there's such a gap in understanding that APMA and the profession writ large has, that we need to get these huge, impactful foundational pieces first. And as a quick aside, I saw the episode with Andy Meyer from it recently, and he actually reached out because he's doing similar work, and there was no, like, he didn't know we were working on some of these things. And it's great because he's taking a parallel but slightly different approach. And so his data set, it turned out, had some statistical qualities that we could leverage. Ours had some that his doesn't. And so we're going to come at different numbers because of those differences. But those differences are useful because we know where they come from, so we can triangulate where we're wrong, where we might be right, where the future study might lie.
I find that so interesting. And I appreciate that you brought that up, because it is one of those, I've taken several different compensation surveys over the years. And the ACFAS, American College of Foot and Ankle Surgeons, who I'm assuming is when you talked about Andy, who's wonderful at really getting down to the statistical reasoning behind things. And prior to this survey through APMA, I feel like the ACFS was the only organization that had something out there to give us data when students ask us, when we try to, or I'll just go back to I language now, when I would try to go to my hospital to talk about compensation or call pay or any of these things. Otherwise, you're just like, oh, well, he said and she said, and it gets very muddy very quickly.
Yeah, absolutely. And actually, just for precision's sake, I was deliberately a bit vague about what Andy's working on because he's gearing up for publication, hasn't been released
Fair
yet.
enough.
So it's not precisely the compensation piece, but I'm going to be a bit vague on that if that's okay, because I don't want to blow his spot, more or less.
Yeah, completely.
Wonderful. Okay, so what was I going to say? I'm sorry, I lost my train of thought. It's been a long day. Would you say that last piece one more time?
So I guess where it transitions to is when we're thinking about the value of this data that you will get from these surveys, why do you think as a podiatrist people should care about the data? Like, why should they fill it out? I mean, I have my reasons why, but what was the thought in terms of, as Jeff said, starting with the end in mind? What is it that you would hope people why they would care about this?
Yeah, absolutely. And I remembered what I was going to say in response to your last statement, but let me answer that first. So why should they care? Data transparency is good, especially if, for example, you are a podiatrist or someone who's interested in becoming a podiatrist, you're in podiatrist school. You need to know what things look like, to be crude about it, in order to make informed decisions. And so, for example, if you are a DPM student and you are preparing to enter the workforce, you need to know, what does life look like as a hospitalist? What does life look like as a private practice owner? What does life look like as an associate moving in while you're getting your feet wet? And that's one of the things we're seeing here. Those are vastly different things conceptually within within the industry. And you need to know those things to then be able to say, okay, I want to throw out my own shingle and open my own practice. Where do I go? How do I position myself in order to be successful? And you see cases where people are very good at podiatry and they're excellent surgeons. They have the technical skills, but maybe they're not business people. And those are vastly different skill sets. And being able to build, knowing which codes to use, which modifiers to use, in order to not to game the system, never, but to be able to not cut yourself short. Knowing how CMS looks at different Medicare claims, things like that, so that you can know how to leverage your skills and set yourself up in the best position. And that's sort of associated with my response to your previous question. And some of the criticism or the skepticism we received at the start were in relation to, I'm a podiatrist. I make nothing near what the official quote unquote average advertised salary is. What is going on? Is the data biased? Why am I not seen? And podiatry is heterogeneous. There we go. Podiatry is different. it is not the same thing. People in different areas, different working circumstances, they have vastly different compensation situations, and those differences get lost in broad statistics like the average compensation. It's not that those numbers are wrong, though we are seeing some evidence that maybe past compensation surveys have not been representative, and that's one of the big things we're trying to address. We're specifically trying to oversample certain populations who we've noted have been lacking from previous surveys, so that we can then, for example, for people who don't respond, we know the relationships amongst the heavily surveyed people. We don't know the relationships among people who've been missed. We need to know that information so that we can understand their situation and give them the support and the knowledge that they need.
Sam, I have a question for you. For any of our colleagues that are listening to this podcast and they're like, well, I'm thinking about doing that survey, maybe hopefully we'll convince them to do it. Can you talk about the survey a little bit and talk, because people have questions, like how do you stratify groups? What are the different things you're looking for to help stimulate people to fill out the compensation survey? Could you give us a little background or a little overview of that?
Yeah, I'd love to. So Marit, one of the wonderful things that they brought into this is, yes, they sort of generate a total compensation figure, but that's derived from all sorts of nitty-gritty of what compensation might look like. Do you get 30% of collections? Do you get, what income do you get from bonus sources? What is your base salary? What is, all of these different things. What is your dollar per WRVU if that's your compensation model? Do you work in a small practice? Do you work in a multi-specialty practice? Are you in academic aspects of things? And if so, what percent of your time and your compensation is coming from these different pieces? And so that sheer granularity in how they're measuring it is both because they understand the profession and the medical profession across specialties as a whole. They're trying to get at all of those different previously intangible pieces, but then also collecting in a way where we can really dig into clear questions. So for example, one of the things that we've gotten a lot of questions about is on-call volume. So DPMs are concerned because they feel that the on-call responsibilities may not be on par with other specialties. They might be getting required to do unpaid on-call, things like that. And so what we're able to do is look into what are actual on-call trends, not just for you, but across the lived experience of podiatrists in all sorts of different circumstances. And so, or for example, questions about, are people tending to look for hospital positions, or is private practice or large super groups or multi-specialty groups, how is participation in those various pieces actually changing? APMA is an organization. If we don't know that stuff, we cannot support the profession. And if you as a new incoming about to finish your residency want to decide how you are going to make your next strategic move, you need to know that stuff so you can make informed decisions.
And geographical too.
And geographical. Yep. There's that old saw that moving to a rural area, that's a way to increase your earning potential. Maybe you don't want to do so. Maybe you love the city nightlife. Okay, which urban areas might be higher paying for the type of position that you're looking for. Alternatively, if you want to go work in a rural area, serve underserved populations, wonderful. Where might there be gaps? Where might there be opportunities?
I like that. So when you look at, you mentioned before you couldn't start this unless you knew how many podiatrists there were. What did you find out? How many podiatrists are there? That's always a great question, right?
Working on it.
Are you? Okay.
Part of my strategy around it is not basing it on the number of people per se, but sort of on full-time equivalents. So for example, if we were to look at licensure data, you would see, I'm just going to throw out a number, let's say 23,000 licenses out across the US. That is dramatically incorrect. Because, for example, my wife is a therapist. She has a license in Kansas. She has a license in Maryland. My brother's an osteopath. He has a license in PA, a license in New Jersey. And so the actual number that we're sort of hammering in around is roughly around 15,000 or so. But the preliminary, a lot of work to do on that one, but preliminary. So all of that is to say, these existing sources are out there. The tricky part is triangulating and trying to figure out what is the best guess. And I say guess because all statistics are incorrect in some way. What is our best understanding of what the numbers look like? And so one of the pieces that I'm hammering out is so the question of, all right, state numbers aren't good enough. I tell you there are 900 podiatrists in California. That does not help you decide where you're going to situate yourself. So my goal is to basically create a gridded map of the United States and say down to 100-meter squares across the country, what is the number of full-time equivalents of podiatrists per square? And if we're trying to model this, who cares if there is a podiatrist in San Francisco? It's great to know, but the real question is, how far are their patients coming from? What is the catchment area where they are serving? And trying to figure that out, and that varies dramatically, different from a rural area versus downtown LA. And the question of, okay, if you're trying to figure out down to that level of precision, state licensure data, that might help you wrangle sort of big picture aggregation, but it's not going to tell you where somebody is in Topeka, Kansas. And so what do you base it on? Billing location, because that's one of the things that are a possibility. You can work with that, but what if there's a clinic where you work in 1 day a week? What if you manage 3 practices? So trying to come up with and tease apart from all of these different data sets, all of the different geographical signals, and try and triangulate potential locations for each person, and then plot that across the surface. So that's the work in progress.
Joe, I'll keep asking questions if you don't jump in.
Oh man. So again, this is what's so fun, right? Is you start to peel back the layers of the onion and you get to see how much nuance does go into not just what we do, right? But then the nuance of how do you piece that out? And I think the point that you brought up at the very beginning, Sam, we're not all the same. So you already have that variable. We also don't all do the same things, even in the same cities. And so as you've been trying to build statistical ways to back up and triangulate and cross verify things, how do you avoid bias and keep your data trustworthy?
Yeah, so there are 2 pieces to that. One is statistical and the other is approach. So on the approach side, being trustworthy. And I want to put this out there because this is one of the biggest questions that we've gotten is I want to fill out your survey, but I don't want my compensation information just out there. I don't want APMA to know that. Fair? All right, great. That's your druthers. Fair enough. I'm not here to tell you how to feel about that. So Marit has all the detailed individual level data in their system, but we will never see that. APMA is going to get aggregated data, so combined data. So and they have a rigorous methodology that they use. One of the things I used to do at Census Bureau is data disclosure avoidance sort of trainings, and I've published on it, done a few pieces on it, and their methodology is good. Their methods are stronger than some IRS and Census Bureau release methods. It's good. And those are methods that those agencies have used for populations who are at risk. So yeah, one of the biggest things is making sure that people realize that we respect their privacy and we are not going to have access to their individual level data so that they feel comfortable giving us accurate information. If people, usually in this sort of thing, one of the post-enumeration, post-census or survey pieces that you do is to look and try and figure out how much do we trust the data? Which pieces do we trust? And you can be being proactive about addressing these sorts of concerns is one of the biggest things that you can do. So that's one thing we do to make it representative and trustworthy. Other aspects, the two other usual pieces are looking at how well is your survey items constructed. Does it measure the things that you're interested in? Merit's good. It does. That's one of the things reasons we were so happy to use their survey basically as is. The other piece is, okay, trying to figure out of the responses you got, how accurate, how representative are they? And that's really, there's so many different ways that you can look at it. And we're going to use a lot of different ways because single methods, that's one thing with statistics. You apply a lot of different methods. Yes, you want to design a good, clear analytical pathway ahead, but these things are complicated. Methods have strengths. There are pieces of the data structure that different methods are strong at, ones they're weak at. And so you apply a range of different things to try and figure out, okay, for example, does the age distribution of responses match what we know of podiatrists for that area? Maybe we look at the responses from California and there are 2,000 responses. I don't know. But we know from other sources that there are only 500 NPIs. All of these numbers are made up on the spot. We would know that is probably incorrect. Or we know that schools have been graduating this number of people, and but if we look at years of experience, which is one of the questions that's asked, and we see that, say, maybe 2,000 people were graduated in the last 5 years. Again, making up all these numbers on the spot. But we have responses for only 400 people. That is a strong signal that we are not getting a representative chunk, either in relation to the other groups, or maybe we're missing big chunks of people's lived experience. And so those are the big things, like being trustworthy, making sure things are designed well, and trying to figure out how does this look in relation to your existing knowledge.
I love that.
Yeah, me too. I've got two questions. Is there early returns? Maybe it should be early concerns, maybe both. Or do you have any early returns? How many people have done the survey? Are we getting where we need to go? What's your confidence levels? I think all the questions that people are listening want to hear.
Yeah, so there's a process where a survey comes in, it gets goes through an algorithm that checks how does it look compared to previous data. Is it in the to simplify what they do, you might say, is the total compensation number lower than the bottom 5% of people who have responded in the past or higher than the top 95%? If so, let's take a look at it. And so they take a look at it and see how realistic does this look? Because in things like this, in Glassdoor, I've been guilty of this myself in the past. People might make fake numbers to try and access the results. Apologies to the people who I've had fake data into their system when I was an 18-year-old. But so data comes in, they look at it, gets approved, and then comes into the sort of the aggregated database from which their dashboards show. So all of that is to say we have about 850 responses that have been fully approved and vetted and made it through at this point. There are a bit less than 100 that are in various stages of validation. Not to say they're bad, not to say they're going to get rejected or anything, but something or another makes them an interesting and outlier case. And so Marit looks at those and makes decisions based on that. But yeah, things are looking good. I say that not to discourage anyone from responding. The more information we get, the more representative it can be. With every breakdown you do, you need more people in order to make the survey powered to actually be able to make assumptions about them. If we want to look at it by age group, that involves many more people. If we want to look at it by specialty, many more people. So things are looking good. But I'd like to implore people to continue responding, especially the youngest population. Let's say younger, I mean years of experience, the freshest out of their residencies or fellowships. Largely because that's a population which we see some indications that maybe they haven't been as represented in previous studies on this. And so we understand them less. And so we want to make sure that we oversample that as much as possible. Along with that, people who've been practicing for 15 to 20 years. We're less concerned about that just because we have a better previous understanding of those relationships. But like to throw out a crude example, maybe we know that those people make 20% less than people who've been working 20 to 25 years. So we can make good assumptions about missing people who haven't responded. That said, 15 to 20 is a range of years of experience, is a range that we are lagging a bit in. So if you fall in that range, we would love for you to respond. Oh,
Very
and
good.
I want to say, if anybody has any questions about this, please send me emails, call me. My information should be on the website, and this might be a question for you guys, but would it be possible to send out my email address along with this for people who have any questions?
Absolutely. We'll put it in the show notes. And we'll do everything we can to help push it out. That's the plan.
Okay.
So if there's specific demographic groups that you need more representation from, as you just discussed, I mean, they're likely the people that are on social media and we'll see it. So I think we'll definitely be able to help.
My biggest, if I may, really quickly, my biggest request is for your listeners, if you feel like your experience and your situation is not represented by the numbers that you've seen in the past, respond. This is how we address that and make sure that your situation is visible and you are seen.
That's great. I noticed, Sam, that you jumped right in on Student Doctor Network and started, sharing the information about the survey, and that's a really that's a population that we want to capture, right? So I thank you for doing that. I follow you on that, right? And you've responded well. Thank you.
It's fun. People are passionate there, and I mean those are the most fruitful people to speak with because they and by they I mean like the disenfranchised people, the people who feel that you and your organization are not meeting their needs. Because if they're feeling that way, there's clearly a gap. And so if there's a gap, if we're missing something, okay, great. I'd love to have that conversation.
That makes sense.
And I got a meme about it. It's great.
I saw that meme. It was great.
That's a sign of loving endearment. It's like you've made it if you get a meme.
Let's pretend, sure.
Oh my gosh, that's fabulous. So let's see, where do you want to go next with this? What do you wish all podiatrists want to know? Everybody. I mean, what's the end game here is to give us lots of good information. But once we get the trust you talked about, once we get data that's reliable, then we have other opportunities, right? We have other opportunities to dive in on different topics. So I think this is kind of like going to snowball and get bigger, and we're going to get more and more data. What are some other areas that you think we should look into within our profession?
Oh, there's so many interesting things we can dig in. So some of the pieces that I'm looking at are, all right, what does demand look like? What does saturation look like? You hear very different narratives. You hear people saying, oh, population with across the US with diabetes and various comorbidities is growing. And so that means more demand for podiatric services in the future. That is very valid. There are intricacies in that. Questions about maybe who might serve that? What does competition look like for that sort of work from other specialties? Along with that, that is a very different type of service, both in terms of expertise, interest, from those who are maybe passionate about surgery. And so if you're going to describe demand, this is the demand for a podiatrist for Mansfield, Ohio. You can't say that and give like one number. This is the number of patients, not responsibly if you're trying to lump the profession as a whole. And so trying to break apart what does demand look like for various sectors of podiatric services. So there's that. Looking at what does survival look like for a podiatrist? There are these sets of statistical tools called survival models. What you can do is sort of look at it like surviving to retirement, like living through an HIV epidemic. You've got what you want to see is who are all the people? At which point do they drop out of the population? At which point does a podiatrist maybe start a practice, for whatever reason, they're unable to be successful, and they say, I'm out, I'm gonna go teach surfing in Maui. Great, good for you. But trying to figure out what keeps people in a position where they can do their career through to retirement. And so based on that, you can sort of figure out, okay, outside of the whole population, this is sort of the retirement rate, this is when people drop out, but what sort of individual characteristics, work environment, gender, things like that, might lead to being able to survive longer in the profession. If we can figure that out, we know who might need more support than others. And then your young doctors might be able to look and say, okay, what are the pitfalls I might want to be strategic about avoiding in order to be most successful in maximizing my compensation, maximizing my happiness in my career? I'm doing things like CMS is looking at changing how they do payments for skin substitutes. It can be very lucrative for for some providers, and there's some challenges around that. I looked at their proposed method, and it is very fragile. Basically, small changes in their alternative assumptions they made lead to a fourfold increase in what they would plan on paying providers per square centimeter of skin stuff. That is a massive difference, and you can't make big picture across the United States changes to a key part of some providers' income strategies based on an estimate that fragile. And so we put that, APMA put that just earlier this month into a letter and into some other avenues towards CMS to try and affect those choices and support our members. Looking at distributions of residencies and fellowships. We've had concerns from some members that maybe there have been some expansions in the number of fellowships out there. People who might be doing the residencies, some folks are concerned about, does this affect my ability to meet my required procedures? And so I'm looking into that. I've been making maps all afternoon today. It's been fun, but looking to see which locations might actually there be competition. Competition isn't quite the right word, but where might these concerns be validated and where might they be less supported by data? All sorts of different things. There's so many different questions to look at.
Sam, I got one for you, and you've probably been thinking about it. So I've been in meetings this week with very passionate discussions of numbers of podiatrists that should be graduating each year. And I've heard passionate pleas for 300, and I've heard passionate pleas for 750. How do you decide that kind of thing?
In terms of, 300 to 750 what?
Graduates of the podiatric colleges per year.
So that is a heck of a question. And I am comfortable saying I do not know enough to be able to speak to that. I will say it is one that is on APMA's radar. It's one where we have little to no power to affect. That sort of thing, that falls under the purview of the medical schools, under CPME. APMA does not control that. That said, we can look at it, see what does demand look like, what is the relationship between new doctor volume and saturation. That's where one of the reasons why I prioritize trying to figure out what does demand, what does saturation look like? Because in order to answer that, we need to say, what do the volume of orthopedic surgeons look like? And thus, what does the surgical chunk of it look like? What are changes in mid-level scope for historical wound care? And so it's separating out those pieces so that we can actually provide useful information that the people in leadership at schools, people making these decisions, can use to make informed decisions.
And that's what I meant. I was talking about saturation versus demand, of course. But I mean, you're right. You can't directly influence it, but good data can influence it.
Absolutely. And we're trying to piece it out.
Joey, any next question from you?
Yeah, and so this is where I also think it's so my sense of why this matters so much, or why I'm passionate about it myself. When you don't have data to back up the things that you think you know, it makes it very hard to bridge that gap. And so one of the examples that I have had several conversations with state societies and national organizations is this idea of how do you, we know that we're valuable to the healthcare system, but how do we show that value? How do we demonstrate that value if there isn't transparency in the data? And you've already pieced out, there are a lot of reasons why it can be difficult to get that clarity because there is this spectrum, but it's certainly, so there was a previous study that had been done looking at specialists and actually looking at healthcare in general, the Marit Hawkins study for physician inpatient outpatient revenue survey. And this was, I thought, really impactful that specialists on average, again, average, there's a lot of variety in specialists from interventional cardiology, orthopedic surgery to pediatrics, right? Like all of these different specialties. And I wrote some of these down so I didn't misquote them. The average salary was around $355,000 a year. Very reasonable, right? But the amount of revenue that these specialties bring to their hospital system was $2.4 million. So the difference between what we bring, what we cost the system versus what we're bringing to the system is dramatic. And one of the things that I find, certainly, again, I'll switch to I language now and not project onto people, but it's very hard to advocate for yourself. When we signed this Hippocratic Oath, we are here to serve our patients, and you don't want to feel greedy, right? Like, oh, but I know what I'm worth, and I'm going to walk into this hospital and explain my value. It's very hard to do that without data to back date, like evidence-based data, not here's a survey I found online, or this is what Glassdoor says, which, to your point, Sam, has tons of variability, tons of bias that has been built in, and it makes it very hard. And so one of the things that I find so valuable about this is if we as a specialty, we know that we bring value to the system, that has been very well published in the literature. The part that we don't really know is the compensation side. And maybe there isn't a big gap in fair market value, however we choose to quantify that, but maybe there is. And so especially if I'm a brand new doctor, and I don't know, and I definitely don't feel comfortable asking people, hey, what do you make? Hey, you're in a hospital-based system. How much do you get paid, right? Like, we don't have these conversations, but I don't know why. And it's been interesting as I've talked to several different, mostly surgeons across the country, there is this weird taboo about talking about it. And so if part of it is, there's the ego part that you could peel out, this is a nice way to be able to contribute to meaningful data that impacts everyone. We can do it anonymously, but I think it's important that we start having more of these transparent conversations because that is how we also support each other. I remember going to my hospital and asking about call pay because I was spending so much time as an independent contractor to the hospital taking call. Come to find out, other people in my community were being paid. And then what I was thinking I would go and ask for, I treated this particular person's father, and she was able to help me. Hey, just so you know, this is what other specialists are being paid. If I didn't have that data, I would have had nothing to base. And by the way, it was way more than what I was expecting to walk in to ask. But if you have some of these data points, it takes that feeling of like greed out of it. And it just really starts to say, look, I know that I'm providing a valuable service. I want to provide it to you because I care about these patients. But my time is also valuable and I should be compensated fairly. And it's hard to judge that fair when you don't have data. So that wasn't really a question. It was a little bit of a soapbox moment of why I think that this stuff matters and why anytime I get a compensation survey, I always fill it out because we need to support each other in this mission of what is fair. We're not necessarily asking for things that aren't fair. So I guess my last question for you is, knowing all the things that you know about building these surveys, trying to alleviate bias, making them trustworthy, what is it that you wish we knew that maybe people taking the survey don't know?
Yeah. So this is a good lead in. There was a point I wanted to make. So I love the soapbox. It's
hard not to sometimes.
it's data opaqueness only affects those who have the data. I don't know if you remember back in the day, if an airline oversold, you go there and they're like, okay, we'll offer $500 if you'll take another flight. 800, 900. Some brilliant statistician for the airlines switched things and started, now there's a bidding system, blind bidding. And so you go and they say, go on to this and say, send us secretly how much money you would take. And then instead of competing everybody against the airline, knowing your value, everyone starts getting, am I greedy? I'm competing against everybody around me, not against the airline. Brilliant move by the airlines, like objectively, but don't love it. That is data transparency in a nutshell. If you have this information, and this is based on nothing except my conspiracy theories, but the big entities in the medical world, they know this stuff. If you are an insurance company and you know exactly where the podiatrist claims are coming from, who they are, you can precisely locate exactly where this need is. Those, both from a business reason, they wouldn't share that, but also, they're quite rightly bound from sharing people's information. Great. But they have that information, they have influence. You as a provider need to balance out that access. And having access to this compensation information is key. And one of the questions that we've gotten from early responders was, what is Marit going to get from this? I sign up, it doesn't cost me anything. How is Marit making money from this? Which is a valid question. I can tell you they're not selling their data. They have been hammering out the contract around this. Some of the biggest issues were in hammering, not issues, but sticking points were in trying to hammer out what the exact ways and what pieces of information they can share while respecting people's privacy. And a lot of figuring that out came down to, we're both on the same page on that. Let's figure out wording that respects that. But all of that is to say, one of the ways that Marit is planning on monetizing a platform such as it is by offering contractual review for specialists. So you are a podiatrist. You are coming in, you're getting your first contract. They're working on, I don't think they've rolled this out yet, but one of the first things that they're going to be rolling out in the near future is a service where, for a small fee, of course, their lawyers, their people will look at your contract and say, okay, based on all of these things, this is what the data says you are worth. This is what a good offer would be. This is what a bad one would be. And they will help you with that process. And so doing, it takes out, the healthcare system has lawyers and HR people throwing out these numbers, gives you that same service. I throw this out both because I think it's valuable and very cool, but also because I don't want people not taking the survey because they're worried they don't trust Merit, and the question of the monetization aspect is opaque.
Yeah.
Sam, I have two questions for you. First of all, would you be willing to come back on Dean's Chat in 6 weeks or so and kind of cover some of the ground as we move forward? And I didn't get to all my questions, but we're kind of running out of time. Would you be up for that?
Absolutely.
Okay, and then my second question isn't mean to get you off guard, but are you a scientist or an artist when you're doing statistics and developing models and trying to, because I imagine you come into work each day and sitting down and, once it's done and you're gathering information, it's one thing, but it takes a lot of creativity to put these things together. So your thoughts?
I love that question. That question does good things for my ego. My answer is both. The You need to approach this with a clearly defined scientific lens to how you're going to be approaching this. What do you think is the relationship? What are your null hypotheses? What are your alternative hypotheses? How are you structuring this in a way so that you make sure you're approaching it systematically in a way where your expertise is leveraged and you are not missing things? That said, one of the things I love most is doing cartography. I like making maps. I used to call this stuff doing arts and crafts in the government, where I'd sit there for a day and I'd make pretty maps. It'd be fun because you're trying to figure out, okay, you can make the messages that people get from a map dramatically different just by setting your bins. Do I make this thing change color from a deep red to a light red, from it being above 10 or below or above 7? Just throw something out. And so making those choices in a way that both is responsible and provides correct information while also communicating the results in a way that people's artistic interpretation reads in the way that you want them to. Artistic choices. So that's a little of both. I love that
I
question.
like that. I sensed that, but I wasn't sure. I was interested in your response. Joe, any last questions? I know we're running out of time.
No, just the beautiful artwork behind him, I thought is possibly where you were going with some of that. But yeah.
Well, I thought next time we meet, we'll do rapid fire questions because I have a feeling, Sam, you've got some good background on things. So thank you so much, Sam, for carving this. I know it's later back on the East Coast, but we appreciate it. And we look forward to having you back on Dean's Chat.
Oh, this was great. I really appreciate the opportunity. Thank you for the time.
You're welcome. And to all of our listeners out there, if you're listening on Apple or Spotify, please give us a 5-star rating and perhaps leave a comment or two. And if you're watching on YouTube, we'd love for you to become a subscriber. Joe and I will continue to bring leaders and people that make a difference in our profession, like Sam is doing with the American Podiatric Medical Association. So thank you so much, Sam. We're going to send you a Dean's Chat mug to get your day off going, get that artistic brain going and the scientific brain going. And until next week, everybody, cheers. Bye-bye.